My name's Bria Scales. What's your name?
Vanessa Chester.
Okay, well, it's nice to meet you, Vanessa.
Too.
Today I'd like to discuss male nursing, and I have a few questions I'd like to ask you. Is that okay?
Yeah, that's fine.
Okay, so the first thing I want to talk about is, could you tell me about your experience with a male nurse?
Well, about 2 weeks ago, I had my yearly checkup, and I was expecting, usually it's the same lady every time that always takes me back to, prick my finger and all that stuff. But it was a male this time, so I was surprised, never seen him before. He was really friendly. He asked me how I was doing, where I went to school, and everything.
Good.
He wasn't too bad.
Oh, okay. So it sounds like your experience was overall pretty well.
Yeah.
Okay. So, it's been assumed that men do not possess the sensitivity and submission to authority that women do. Therefore, nursing is a woman's profession. Do you believe this statement holds true?
Well, when I think of the nurses, I think of women immediately. I wasn't expecting him to walk in there.
Mm-hmm.
But I think that men, they're not really capable of being that sensitive. So, I don't know. I would probably prefer a female nurse.
You would?
Yeah.
Do you think that's because you are a female, or
Yeah.
so if you were a male, you probably would prefer a male
nurse.
nurse? Okay, that's understandable. Most people are that way.
Mm-hmm.
So a study showed that male nurses make higher wages than female nurses. Why do you think that is?
Because there's not that many of them. You don't expect to, if you're a female, you don't go to the doctor, you don't expect a male nurse to walk in.
Mm-hmm.
So there's not that many of them, so I would expect for them to make more money. I don't think it's fair, really. But
Are there certain qualities that they bring to nursing that females don't, which maybe...
if there's a male that comes in for a checkup, then it would be nice to always have a male nurse there.
Yeah.
So
That's definitely a good thing, positive.
Mm-hmm.
Well, some people also believe that male nurses create, make a stable work environment. Do you agree with this statement? Why or why not?
I do. I think they bring more balance to the work environment. So I think it's good that they're there.
Okay, well, I understand that. So one last thing I'd like to ask you, if you could summarize your image of nursing into one word, what word do you think you would use?
I probably use nurturing.
Nurturing.
Mm-hmm.
That's interesting. Why nurturing?
Because nurses are supposed to care for the patient, take care of them, and, provide, advice and help them keep up their health. And so they're just caring, very sensitive, passionate,
Okay, well, I thank you for coming in and letting us hold this interview with you.
No problem.
And you have a great day. Thank you.
Too.